Usually I will briefly mention my way of rounding, and I try to set the stage by making them comfortable, making sure that they understand that I'm here to help them, help the process of seeing the patients, make sure everything is done well, and at the same time highlight that this is their opportunity to learn as much as they can. It will take a big part of it on their efforts and on myself setting the stage, making sure that I meet the requirements of seeing patients in a timely manner, getting the work done, but at the same time encouraging them to always ask, not leave things unsure of or not clear. You are here to learn. I'm here to support you and help you get the work done and get you learn as much as possible. It depends, but just the first day it's hard to get a feel. It's just an open invitation to feel relaxed, and they can ask without feeling intimidated, and at the same time this is an opportunity for you to gain as much as possible. Yes, I have to be sensitive to the patient's load, and that's really what helps me sometimes to decide if I'm going to do walking rounds versus sitting rounds. So if I have a big service, usually what works the best is sitting rounds. So the patients will be presented to me, usually by the students, with some guidance and prodding from the residents. So I will be able to do some teaching points, not really dedicate a whole 10 minutes on every patient to teach, but as they present, I will highlight points in the complaints, in the presentation, in the physical exam, in the labs, that will be like pearls on every patient. At the same time, my resident can turn around and put orders as we speak, so we go from one patient to the other. I am able to provide feedback to the residents, to the interns, at the same time teaching the med students who will benefit from those tips, and at the same time not to be a barrier again in the way of getting the work done for the team. It's not my job only as a teacher, but as an attending, I am attending to the team, to the needs of the patients as a priority, and the needs of my trainees when it comes to teaching as well. And the key is how to balance them. So basically, I always ask questions, but I don't ask questions of a particular individual. So I will present the questions and make sure I look in the faces and not really pick on certain person. But usually if there is somebody is comfortable and know the answer, they will step and provide it. So without putting any one of them on the spot, I present the question. It helps two ways. Number one, get them into the discussion. At the same time, it will give me the opportunity to figure out where the need is. So I will present the questions, wait a little bit without really pointing to a certain individuals, and then I will provide the answer. At the end of that discussion, those who didn't know it will gain the knowledge, and those who did, I didn't really take away from them the chance to prove it without intimidating any of the listeners. That's a very good question, because I believe that professionalism is not taught in classes, but it's actually absorbed and grasped from people that we respect, and we have really a strong feelings that we want to be like this person. Seeing the caring that I need to stop and be with the patient as long as the patient needs, that's caring, regardless of where I am in the numbers of patients that I'm seeing, or where I am in the number of notes that I have to write at the end of the day. I think caring is something that the students, and the earlier the stage of their training, need to see. We are there as long as the patient needs us. I'm not signing in and signing out. I am there because my patient needs me. That's something they will never get in a classroom. They will get it from watching somebody they respect. And at the same time, they are not afraid of. They are not afraid to ask. They are not afraid to approach. And if I'm very bright, but I'm very hard to approach, I failed as a teacher. It will be unfair to ask from my resident anything that I don't do myself. Every patient represents a new opportunity, and it helps me always when I present the questions and I don't see a feedback or a response, then that's an area that's really still needed, and so on. So even though I may be presenting or filling in for a day or two, I am at the end of those 2 days, they feel they got really additional, not just a repetition of something redundant, but rather something new that they felt on those patients that they didn't know before.